Welcome to the Basics of Diagnostics Imaging series, Computed Tomography or CT Scanning, a basic review of CT imaging. The learning objectives of this course are to define CT, discuss CT scanner uses, compare and contrast CT with MRI and X-ray, and view CT scan images of abnormal and normal anatomy. Computed tomography, or CT scan, is a diagnostic procedure that uses special X-ray equipment to create cross-sectional pictures of your body, also called CAT scan, or computed axial tomography. This diagnostic procedure is used in a multitude of medical disciplines, including orthopedics, general surgery, trauma, cardiac surgery, and etc. There are a few types of CT scanning machines that can scan a patient in different positions. The one you see here is a horizontal CT scanner. This CT scanning machine requires the patient to lay supine or on their back on a motorized gurney. This is the most common type of CT scanning machine. Another type of CT scanner is an upright scanning machine. This allows a patient to be in the seated position while going through the procedure. This type of CT scanning is preferred for diagnostic imaging of the head, neck, lungs, and sometimes the spine. There is literature to support the fact that some pathologies are better visualized using this type of CT scanning machine. CT scanning involves the use of low-dose radiation to create cross-sectional slices of the anatomy being scanned. During this process, a thin X-ray beam rotates around the area of the body being scanned and generates an image of the internal structures. Some CT scanners can compile a multitude of images in the coronal, sagittal, and transverse planes to create a 3D rendered image of the anatomic structure. We'll talk more about this later in the module. The CT scanners you see today aren't the same CT scanners we started with many years ago. The first CT scanner took several hours just to acquire the raw data for one slice of information, or image, and took days to reconstruct a single image from this raw data. During its 50-year history, CT has made great improvements in speed, patient comfort, and resolution. Tremendous research and development has been made to provide excellent image quality for diagnostic confidence at the lowest possible X-ray dose. The images you see below are CT sagittal views of the ankle. Note how clear and defined the bones are, much more than what a traditional X-ray can produce. However, CT scans do cost more than traditional X-rays to perform. Here is another example of the clarity a CT scan may produce. The image on the left is a transverse view or slice of the knee. The image on the right is a sagittal slice. Slices, or images, are around 1 millimeter each or less, so a physician will have many images in several planes to better visualize pathologies. Simply stated, a CT scan is an examination that gives the physician a completely unobstructed look at structures that cannot be seen clearly on conventional X-rays. CT has several diagnostic uses. The image on the left is a coronal view of the humerus. Can you see the fracture just below the humeral head? The image to the right is a sagittal slice of the knee. The bright white area represents bone cancer in this particular case. The three images to the left, starting from the top, shows a blood clot. The second image down shows calcification of the heart, suggesting signs of heart disease. The last image on the bottom shows an arrow pointing to internal bleeding. Now let's discuss the CT scanning procedure. The patient lies still on the table in a supine position or on their back. The motorized table slowly passes through the center of the large X-ray machine. Here, the X-ray beam spins quickly in that circular tube. The test is painless. During some tests, you will receive a contrast dye such as gadolinium, which makes parts of your body show up better in the image. We'll talk more about that later in this module. In this section, we'll talk about the benefits of CT. In the image to the right, you see a CT scanner machine tethered to a high-power computer. Together, these produce a precise picture of the body, allowing the physician to see tissue and bone structure in fine detail. Now let's go over some of the differences between CT, MRI, and X-rays. Let's start with CT versus MRI. The images on the right depict an MRI in a CT scanning machine. Can you tell which one is which just by looking at them? They are very similar in their appearance, but function vastly differently. The top image is an MRI machine. The image below is a CT scanner. Unlike CT, MRI uses magnets and radio waves to produce the image. No X-rays or radiation are used in an MRI scanner. The patient lies on a gurney very similar to the ones used for CT. They are then placed in a very long cylinder and asked to remain perfectly still. The machine will produce a lot of noise, and examinations typically run about 30 minutes. Now let's discuss the advantages of CT over MRI. CT provides better images of bones. They allow the physician to see bone structure in greater detail. However, MRI does a great job with viewing of soft tissues. As you can see in the bottom image, the soft tissues, in this case the gastrocnemius muscle, shows up very well, but the bones of the femur and tibia are less clear as when compared to the CT image on the top. As we previously discussed, MRI images do not show bone as clearly or precisely as CT scans. However, MRIs are king when it comes to diagnosing soft tissue pathologies. In this image, the black triangular-shaped anatomy is the meniscus of the knee. It is considered fibrocartilage. The white line going through it, where the arrow was pointing, is actually a tear of the meniscus. A CT scan probably would not be able to see this as clearly as the MRI. Simply stated, MRIs show higher detail in soft tissues. You can also change the contrast of the images to view the soft tissues better. And the evaluator has the ability to change the imaging plane without moving the patient. Although CTs use radiation to generate an image, similar to X-rays or radiographs, they have a much lower dose. Because the evaluator is able to get multiple images or slices of a particular body part, they can obtain much more information needed for proper diagnosing than those of traditional X-rays. CT is just a more sophisticated X-ray. CT uses high-speed computers to compile images into complete cross-sectional pictures or slices of tissue and bone. To review CT versus X-rays, a CT scan obtains images of parts of the body that cannot be seen on a standard X-ray. CT scans often result in earlier diagnosis and more successful treatment of many diseases and pathologies. Now let's take a look at some actual CT images of patients with actual injuries. In this image, you're looking at an intra-articular distal radius fracture with an accompanied styloid fracture. This image was taken in the coronal plane. You have better visualization of the pathology that you probably would not have obtained with a standard X-ray. In this image, we see a CT scan of an ankle in the sagittal plane. The red arrow is pointing to a fracture of the anterior process of the calcaneus. Without a CT scan, this injury may have gone undetected if a traditional X-ray was used. As previously mentioned, some CT scanning machines have specialized software that allow them to take many two-dimensional slices or images and render them into a three-dimensional model. This allows the doctor to rotate the rendered image on several planes using the special software. This allows them to see pathologies that may have been missed on X-ray. Here's another example of the appreciation of the severity of injury that you can see on a three-dimensional X-ray model as compared to standard X-rays. The image on the top shows a 3D model of a right ilium fracture. Note how the evaluator can rotate the model to view the extent of the injury in several planes. The image on the bottom is a standard X-ray of the same patient with the same injury. Can you appreciate the extent of injury by just looking at the x-ray? Probably not. The images represented here are the same patient with the same injury as the previous slide. However, the bottom image is a traditional CT scan. You can get a better appreciation for the extent of injury with a traditional CT scan. However, the images on the top show the three-dimensional models, again with the ability to rotate and view on different planes, giving the evaluator a much better idea of the extent of injury. Some CT scanning software allow the evaluator to place color on the images to help differentiate the different textures and densities of the tissue. The top right image is a traditional x-ray of a shoulder. It may be difficult to appreciate the extent of injury with just looking at the traditional x-ray. The image on the bottom is a CT scan 3D rendered with color applied. Here, this allows the evaluator to appreciate the extent of injury by applying color, which differentiates the different textures and densities, which is blood and bone. Congratulations, you've reached the end of the module, but we're not quite done yet. Please click the Start Quiz button on the bottom right to take the final evaluation.